when I'm talking about laboratory procedures, digital tools or analog tools in the laboratory, it doesn't matter. It's the same outcome with using different mediums. I think the underlying philosophies are exactly the same. And here's just go back for a sec. Okay, yeah, that's good. Here's where the rubber meets the road, so to speak. Here's a technician doing a diagnostic wax up. Now, they could be looking at a computer screen as well and trying to design the teeth. We have a very limited view of what's here. There may be some writing, make them look ideal, golden proportions, things like that. But that's limited in my book. So go ahead and advance to the next slide. In our laboratory, we do a smile simulation, and then we actually measure the before photo and go on to the next one. Chris, yeah. And then we measure the same tooth as an after. We're able to come up with ratios to determine that tooth number 8 has been lengthened in the imaging by 1 millimeter. Okay, go ahead and advance. Okay. Also, the technician, when they're waxing, whether it's digitally or analog, they actually have the patient's face. And we recommend full face. Just showing teeth really doesn't show us any of the facial symmetry. And the photos with just teeth aren't motivating, aren't emotional enough to patients, is from our experience. Okay. So in this particular case, we started with a pre-op model, and you can advance to the next slide. And we ended up here, based on what the imaging showed for this patient. Okay. So go ahead. Yeah. Okay. From that diagnostic wax up, we make a preparation guide. And so you can put an outline over your preparations to visualize that that preps are ideally centered and ideally reduced, so that the lab can do a great job. Now, we know where we're headed with this case. The patient approved the imaging. We waxed the case based on what the imaging shows. And now the dentist needs to prepare the teeth to be able to achieve that. Okay. So this is our template, and this is used for making immediate temporary restorations in the mouth. Basically, it's a hard, soft, it's a double suck down, hard, soft layer. Think of it as a metal impression tray with removable impression material. So you load that up with bisacryl or acrylic and squish it in the mouth. You can go ahead and advance and let it set. That hard outer shell doesn't flex, so the material doesn't distort. And so you end up with a very accurate replication of what the diagnostic wax-up showed as temps. There's also very little cleanup in this, just a little bit of, usually a little bit of film up at the gingival areas that needs to be cleaned up. The hard shell comes off first, and then you tease off that soft liner. So if it were all one piece, you would never be able to remove that matrix the way it is, but having a hard soft that separate allows you to utilize it. So it's very accurate. I saw a patient yesterday in my laboratory, and it was just amazing. It's life-changing. So I'm going to show you now a case in the computer. This is an upper-lower, a full mouth case, and you can advance now. Chris, go ahead and advance again. Okay, so we superimposed the model of approved provisionals over the model of the preps. And just go to the next screen. And this is really the shot that I want to show. And this is really where ModMouth really can, if you're planning a multidisciplinary case, it's using ModMouth to put the teeth where they need to be prior to prepping them. In other words, if teeth are splayed out distally and you want to have nice mesial inclinations to your teeth, it's going to be very challenging in the laboratory to try and achieve that. But this to me is like the perfect case where each prep is lined up perfectly within the outline of the desired result of the temps that the patient's living and functioning with. So this is like my dream in my lab. These are the kinds of cases I love doing. Go ahead and advance. Yeah. Okay. And then we're copying the wax up and go ahead one more. One more. So the goal here is to keep everyone in line with where we're headed. I don't want one technician in my team to take the case somewhere that it doesn't belong. We all know the patients living with these temps, they love their temps. Our goal now is to design the final restorations so they fit within the contours of what the patient's functioning with. Go ahead and advance. Yeah. And one more time. And begin. Okay. So this was these were zirconia restorations that this is pre-sinter going in the oven, and in advance. And that's what they look like after an 8-hour sintering in our lab. And here's how they look on the model. Now, I know that right now that these teeth are exactly where they need to be. Now, we may go in and we may do some fine characterization. We may modify a few little items when it comes to shade or texture, surface texture, little things. But I don't want to deviate from the plan that that is the imaging and the temps and now the final restorations. It's lower. Keep going. Staining glaze. Okay, and glazed up, and that's what we end up with. Now, my experience in the laboratory is we don't know what the patient wants. We are relying on you, the dentist, Dr. Steven, to tell us that the temps look great. If the temps look great, our goal, it's not always 1,000% copy 1,000%, but it's very close to where we need to be. Where we run into issues in our big cases is when we start to deviate from the plan along the way. And I can't tell you how frustrating that is, both for me and potentially for the laboratory, for the dentist receiving the case and the patient, because that's not what they ordered.